Feeling stuck? How to understand and heal from the hidden wounds of trauma. Have you ever felt like you're living life with the emergency brake on? Maybe you overreact to small things and you don't know why. Perhaps you feel a constant, low-level anxiety, a sense of dread you can't quite name. Or maybe you just feel numb, disconnected from the people and activities you used to love. You might tell yourself to just get over it, but it feels like there's an invisible wall you can't seem to break through. If any of that sounds familiar, you're in the right place. What you might be experiencing isn't a personal failing. It's not a sign of weakness. It could be the long echo of trauma. Hi everyone, and welcome to our channel. Today we're going to talk about a word that we hear a lot but often misunderstand: trauma. We're going to explore what it really is, how it physically changes our brain and body, and most importantly, we're going to walk through gentle, science-backed ways you can begin to heal. I remember a story of a young woman. Let's call her Maya. For years, Maya struggled with intense social anxiety and a deep-seated feeling that she was somehow broken. She couldn't understand why friendships felt so difficult and why she was always waiting for the other shoe to drop. It wasn't until she began to explore her past, specifically the emotional neglect she experienced as a child, that she realized her nervous system was wired for threat, not connection. Her brokenness was actually a set of brilliant survival strategies her younger self had developed to cope. That realization was the first step on her journey to healing. By the end of this video, you will have a clear understanding of what trauma is and what it isn't. You'll learn why it has such a powerful hold on your thoughts, feelings, and even your physical health. And you will leave with a toolkit of practical, compassionate strategies that you can start using today to reclaim your sense of safety and move toward wholeness. Crucial disclaimer. Before we dive in, it's so important for me to say that this video is for educational purposes only and is not a substitute for professional medical advice. If you are struggling, please be kind to yourself and reach out to a qualified therapist or mental health professional. Understanding trauma. So, what is trauma? The American Psychological Association defines trauma as an emotional response to a terrible event. But it's more nuanced than that. A key misunderstanding is that trauma is the event itself. It's not. Trauma is the response that gets locked in your nervous system when an experience is too overwhelming to process. It's defined by the individual's subjective experience, not just the objective event. This is crucial. Two people can go through the exact same event, and one may walk away traumatized while the other doesn't. It's not about toughness. It's about how your unique nervous system and life history prepared you to cope in that moment. Debunking common myths. Let's clear up a few myths right away. Myth 1. Trauma only comes from huge, life-threatening events like war or a major disaster. Fact. While those are absolutely traumatic, trauma can also result from less overt but deeply distressing experiences. This includes things like emotional abuse or neglect, bullying, medical procedures, complicated grief, or growing up in a chaotic home. We sometimes call these small T traumas, but their cumulative impact can be just as significant as a single big T trauma. Myth 2. If it didn't happen to you directly, it's not trauma. Fact. Witnessing a traumatic event or learning about a trauma that happened to a loved one can also cause PTSD and trauma symptoms. This is sometimes called vicarious or secondary trauma. Myth 3. You have to have PTSD to be affected by trauma. Fact. Post-traumatic stress disorder, PTSD, is a specific clinical diagnosis with a cluster of severe symptoms. However, many people experience the effects of trauma, like anxiety, depression, and relationship issues without meeting the full criteria for PTSD. Your experience is valid even without a formal label. What happens in your brain and body? The neurological underpinnings. When you experience something overwhelming, your body's survival system kicks into high gear. Think of it like a smoke detector. A part of your brain called the amygdala, the brain's threat detection center, screams danger. This triggers a flood of stress hormones like cortisol and adrenaline, preparing you for fight, flight, or freeze. Your heart races, your breathing gets shallow, and your muscles tense up. This is a brilliant survival mechanism. But in trauma, this system doesn't turn off. The smoke detector becomes hypersensitive. The prefrontal cortex, the part of the brain responsible for rational thinking and emotional regulation, can become less active. It's like the wise fire chief is offline, and the frantic smoke detector is left in charge. This is why, long after the danger has passed, you might feel constantly on edge, hypervigilance, have a heightened startle response, or react with intense emotion to minor stressors. Your body is still living in the past, trying to protect you from a threat that is no longer there. Trauma isn't just a memory, it's a physiological imprint left on your body. And you are far from alone in this. Statistics show that around 70% of adults experience at least one traumatic event in their lifetime. Globally, about 70% of people will experience a potentially traumatic event. While most people recover naturally, a significant portion do not. An estimated 3.9% of the world's population has experienced PTSD at some point. Symptoms and early warning signs. So how does this show up in daily life? Trauma responses can be grouped into a few key areas, which are central to a PTSD diagnosis, but also appear in people without the full disorder. Re-experiencing symptoms. This is when the past intrudes on the present. It can manifest as involuntary, upsetting memories of the event, flashbacks where you feel like you are reliving the trauma, distressing nightmares about the event, intense emotional or physical reactions to triggers, things that remind you of the trauma. Avoidance symptoms. This involves trying to stay away from anything that reminds you of the trauma. For example, avoiding people, places, or conversations related to the event. Trying to suppress thoughts and feelings about the trauma, leading to emotional numbness. Negative changes in thinking and mood. Trauma can fundamentally change how you see yourself, others, and the world. This can look like persistent negative beliefs like, I am broken or the world is dangerous, distorted blame of self or others for what happened, ongoing feelings of fear, horror, anger, guilt, or shame, feeling detached from others and losing interest in activities you once enjoyed, changes in arousal and reactivity. This is your body's alarm system being stuck on high alert. Irritability and angry outbursts, hypervigilance, constantly scanning for danger, an exaggerated startle response, difficulty concentrating, and problems with sleep. Recognizing these isn't about diagnosing yourself, but about validating your experience. These are not signs of weakness. They are normal responses to abnormal events. Risk factors. Why do some people develop lasting trauma symptoms while others don't? It's a complex mix of factors. Family history and genetics. A family history of anxiety or depression can make you more susceptible. The nature of the trauma. Long-lasting or repeated trauma, like childhood abuse or domestic violence, often leads to more complex symptoms, sometimes called CPTSD. Experiencing physical injury during the event also increases risk. Previous trauma exposure. Having experienced trauma earlier in life, especially in childhood, can prime your nervous system to be more reactive to later stressors. Lack of social support. This is one of the biggest predictors. Feeling isolated and unsupported after a traumatic event significantly increases the risk of developing PTSD. Conversely, a strong support system is a powerful protective factor. Understanding these factors helps us move away from self-blame and toward self-compassion. You didn't choose to be traumatized. 5 science-backed strategies for healing. Healing from trauma is not about forgetting what happened. It's about creating a sense of safety in your body, processing the stored emotions, and building a life where the past no longer controls your present. Let's explore 5 powerful science-backed strategies to help you on this journey. 1. Reestablish safety through grounding. What it is, grounding techniques are simple exercises that pull you out of a flashback or an emotional spiral and bring you back to the present moment. They connect you to the here and now through your 5 senses. Why it works. Trauma pulls you back into the past. Grounding works by activating your prefrontal cortex, the thinking part of your brain, and calming the amygdala's alarm bells. It sends a powerful signal to your nervous system, I am safe right now. How to do it? Try the 5, 4, 3, 2, 1 method. Wherever you are, pause and gently notice. 5 things you can see: the color of the wall, a book on your desk, the light from the window. 4 things you can feel: the texture of your chair, the fabric of your clothes, the temperature of the air. 3 things you can hear: the hum of a computer, birds outside, your own breathing. 2 things you can smell: the scent of coffee, a pen, or just the air in the room. 1 thing you can taste: take a sip of water or just notice the taste inside your mouth. Real-life application. Imagine you're in a crowded store and the noise starts to feel overwhelming, triggering a feeling of panic. You can step aside, plant your feet firmly on the ground, and run through the 5, 4, 3, 2, 1 exercise. This simple act can stop the emotional spiral and bring you back to a state of calm. 2. Befriend your body with mindful movement. What it is: this involves gentle physical activities like trauma-informed yoga, tai chi, or simply walking, where the focus is on your internal sensations rather than performance. Why it works. Trauma often creates a sense of disconnection from the body. It can feel like an unsafe place. Mindful movement helps you slowly and safely reconnect with your physical self. Exercise can repair the nervous system, reduce stress, and improve the mind-body connection. It helps process trapped survival energy and teaches your body that movement can be a source of pleasure and empowerment, not just a response to threat. How to do it: start small. Dedicate just 5 to 10 minutes a day. Choose a gentle activity. Try a slow-paced yoga video online specifically for trauma or stress. Focus on sensation. As you stretch, ask yourself, what do I feel? Notice the feeling of your muscles engaging or your feet on the ground. There is no right or wrong answer. The goal is simply to notice without judgment. Real-life application. After a long, stressful day where you feel numb and disconnected, instead of scrolling on your phone, you could lay on the floor and do a few gentle stretches, paying close attention to your breath and how your body feels. This can be more restorative than an intense workout. 3. Cultivate self-compassion, the antidote to shame. What it is: self-compassion is treating yourself with the same kindness and understanding you would offer a good friend who is struggling. It consists of 3 elements: self-kindness, recognizing our common humanity, realizing suffering is a shared experience, and mindfulness, observing our pain without being consumed by it. Why it works. Trauma often leaves behind a heavy residue of shame and self-blame. Self-compassion directly counteracts this toxic inner critic. It soothes your nervous system, reduces shame, and builds emotional resilience, giving you the energy to face your emotions instead of fighting them. How to do it. Try a self-compassion break. When you notice a wave of difficult emotion or self-criticism, pause and say to yourself, aloud or internally, this is a moment of suffering. Mindfulness. Suffering is a part of life. Other people feel this way too. Common humanity. May I be kind to myself in this moment? Self-kindness. You can also try placing a hand over your heart to add a layer of physical comfort. Real-life application. You make a mistake at work, and your inner critic immediately starts, "You're so stupid, you always mess up." Instead of letting that spiral continue, you take a self-compassion break. You acknowledge the pain of the mistake and offer yourself the kindness you deserve, shifting from self-attack to self-support. 4. Reclaim your story through writing. What it is. Therapeutic writing or journaling is the practice of writing about your experiences and feelings in a private, non-judgmental space. Why it works. Trauma can fragment memories and disrupt the narrative of your life. Writing helps organize these fragments into a coherent story. This process allows you to externalize your thoughts and feelings, giving you distance and perspective. It helps your brain make sense of what happened, reducing the emotional charge of the memories and fostering insight. How to do it. Set a timer for 10 to 15 minutes. Use a prompt like, what is weighing on my heart today? Or, what does my younger self need to hear? Write continuously without censoring yourself. Don't worry about grammar or spelling. The goal is expression, not perfection. Afterward, you can simply close the journal, or you can reflect on what you wrote. Some people find it cathartic to safely destroy the paper afterward. Real-life application. You're having recurring nightmares about a past event. You decide to spend 15 minutes each morning writing down whatever you can remember from the dream and the feelings it brings up. Over time, this practice helps to demystify the nightmares and lessens their emotional power. 5. Build a secure base through connection. What it is, intentionally seeking out and nurturing safe, supportive relationships with friends, family, support groups, or a therapist. Why it works. Trauma happens in a state of isolation and powerlessness. Healing happens in connection. Safe relationships are a biological regulator. A calm and empathetic presence can literally help soothe your dysregulated nervous system, a process called co-regulation. Building a support network provides the emotional backing needed for the journey of healing. How to do it: identify one or two people in your life who you feel safe with, people who listen without judgment. Reach out. You don't have to share details of your trauma. Simply saying, "I'm having a hard time. Could we talk for a bit?" can be enough. Consider a peer support group for trauma survivors. Sharing your experience with others who truly get it can be incredibly validating. Real-life application. You feel an anxiety attack coming on. Instead of isolating yourself, you call a trusted friend. Just hearing their calm voice and talking about something unrelated helps your nervous system settle, reminding you that you are not alone. A guide to do's and don'ts. As you navigate this path, here are some helpful guideposts. Do's: do go at your own pace. Healing is not a race. Be patient and gentle with yourself. Do prioritize self-care. Ensure you're getting enough rest, nutrition, and gentle movement. These are the foundations of resilience. Do set boundaries. It's okay to say no to people or situations that feel overwhelming or unsafe. Setting boundaries is a crucial part of reclaiming your power. To celebrate small wins. Acknowledging your progress, no matter how small, reinforces your capacity to heal. Don't isolate yourself. Even when it feels like the hardest thing to do, push yourself to maintain connections. Don't numb with unhealthy coping mechanisms. Avoid the temptation to numb your pain with excessive alcohol, drugs, or other compulsive behaviors. Don't compare your journey to others. Your path is unique to you. There is no right way to heal. Don't force yourself to talk. Share your story only when and with whom you feel completely safe. Sharing too much too soon can be re-traumatizing. When and how to seek professional help. Self-help strategies are powerful, but sometimes we need a trained guide. It's time to seek professional help if your symptoms are severe and interfering with your daily life, like your work or relationships. You are relying on substances to cope. You are experiencing thoughts of harming yourself or others. If you are, please call a crisis line immediately. The number will be on screen and in the description. Therapy for trauma is not about endlessly rehashing the past. It's about processing the trauma in a safe and structured way. Effective, evidence-based therapies include trauma-focused cognitive behavioral therapy, TFCBT, helps you change negative thought patterns and behaviors related to the trauma. Eye movement desensitization and reprocessing, EMDR, uses bilateral stimulation, like eye movements, to help your brain process and digest traumatic memories so they are no longer as distressing. Somatic experiencing, SE, focuses on releasing trauma trapped in the body by paying attention to physical sensations. Internal family systems, IFS, a gentle approach that helps you understand and heal the different parts of you that were wounded by trauma. Medication. In some cases, especially with severe PTSD, medication like SSRIs may be prescribed by a psychiatrist to help manage overwhelming symptoms like anxiety and depression, making it easier to engage in therapy. This should always be done under the guidance of a medical doctor. Seeking therapy is a sign of courage. It's an investment in your well-being and your future. Making it a lifestyle, from knowledge to habit. We've covered a lot, and it might feel like a lot to take in. The key is not to try and do everything at once. The goal is gentle integration, not overwhelming yourself. Start with one small thing. Maybe it's a 5-minute grounding exercise each morning, or perhaps it's committing to a gentle walk 3 times a week. Choose the strategy that feels most accessible and kind to you right now. Remember, healing is not a linear process. There will be good days and hard days. On the hard days, your only job is to be kind to yourself. This is where self-compassion becomes your most valuable tool. When you stumble, treat yourself like you would a dear friend. Remind yourself that healing isn't about perfection. It's about persistence and patience. Create a healing toolkit. This could be a physical box or a note on your phone. Fill it with things that bring you comfort and safety. A list of grounding techniques, the number of a supportive friend, a favorite soothing song, a comforting scent. When you feel overwhelmed, you don't have to think. You can just turn to your toolkit. Celebrate your progress. Did you notice a trigger and use a grounding technique instead of reacting? That is a huge victory. Did you set a boundary even if your voice shook? That is monumental. Acknowledge these moments. They are proof that you are healing, one brave step at a time. Supporting a loved one. If you are watching this to support someone you care about, thank you. Your support is vital. Here are a few key principles. Listen without judgment. Your main job is to create a safe space. Don't push them to talk, but let them know you're there when they're ready. When they do talk, just listen. Avoid saying, "I know how you feel," or trying to fix it. Offer practical help. Trauma is exhausting. Offer to help with concrete tasks like groceries, meals, or childcare. This can lift a huge burden. Learn their triggers. Gently ask if there are certain things that are difficult for them. Knowing this can help you create a more supportive environment. Don't take it personally. Trauma can cause irritability, withdrawal, or anger. Try to remember that this is the trauma talking, not their true feelings about you. Encourage but don't force professional help. You can offer to help them find a therapist or even go with them to their first appointment, but respect their decision and their timing. Take care of yourself. Supporting someone with trauma can be draining. Make sure you have your own support system in place. You cannot pour from an empty cup. Your calm, steady, and compassionate presence can be one of the most powerful healing forces in their life. Conclusion and empowering message. So, let's bring it all together. We've learned that trauma is not the event, but the response stored in our body. We've seen how it rewires our nervous system for survival, leading to symptoms that can make daily life feel like a struggle. But most importantly, we've seen that healing is possible. Healing from trauma is not about erasing the past. It's about learning to live in the present with a sense of safety, connection, and hope. It's about gently rewriting the story that your nervous system has been telling you, from one of danger and threat to one of resilience and peace. If you take one thing away from this video, let it be this: you are not broken. You are a survivor. The parts of you that feel like a burden, the anxiety, the numbness, the anger, were once brilliant adaptations that helped you get through something unbearable. The journey now is to gently thank them for their service and let them know that you are safe now. You are whole, you are worthy of healing, and you have the capacity to build a life filled with peace and joy. Be patient with your beautiful, resilient self. If this video resonated with you, please give it a like and subscribe to our channel for more content that supports your mental well-being. And please share this with anyone you think might benefit from hearing this message. You never know whose life you might touch. For our community question today, I'd love to know, what was your biggest takeaway from this video? Or what is one small, kind thing you can do for yourself today? Share it with us in the comments below. Reading through them can be a powerful reminder that we are all in this together. Thank you for being here. Take gentle care.